Hello, and welcome to the Minnesota Health Action Group's Case Study Live podcast. I'm Deb Krause, Vice President with the Minnesota Health Action Group, and this is June 2020. I hope this finds you and your loved ones safe and healthy amid the COVID-19 crisis. We know that employers appreciate learning from each other, including what works to help all employees be their best self, both physically and mentally, as well as insights on the why and the how behind effective workplace solutions. Before COVID-19, this sharing and learning occurred in action group meetings and events like our summit, but now in a more virtual world, we're excited to bring you this podcast featuring success stories from action group supporters highlighting their work with Minnesota employers. And today, I'm very pleased to be joined by Lonnie Stormo, CEO of Pops Diabetes. Pops Diabetes and Lonnie in particular are great friends of the action group. Lonnie was an original winner of one of our Innovators Showcase forums, where he was selected by employers for having a strong value proposition and exciting potential for the company very early in its launch. And now, more recently, our summit attendees voted to have Lonnie's case study made into a podcast. So, Lonnie, you are a winner twice with the Action Group. Congratulations, and thanks for joining me.
Well, it's great to hear that we're a winner twice. Thanks, Deb, for having us today. We really appreciate it.
Yeah, glad to have you here. So let's start out with a quick overview of Pops Diabetes, and then in this case, your client was Minji Digestive Health.
Yeah, thanks. So Pops is a platform that's about flipping healthcare on its head and essentially enabling people, employees in this case, to own their own health using a technology platform. I call it the democratization of healthcare. And so that statement means just like you can go jump in a stranger's car sitting by the curbside and have them safely take you someplace because you have technology in your phone that allows that to happen now, the same thing is starting to happen in healthcare. And our platform is centered around Mina, your AI virtual coach, who enables you to manage your condition wherever you're at, as long as you have your phone with you. And let's face it, that's 24/7 these days. And we partner with Mina, your AI virtual coach, a device to measure your blood sugar. That's about 2/3 the size of a cell phone. It's just a very easy way to measure your blood sugar anytime, anywhere. And those two things together allow you to manage your health better. And we offered that and started working with Minji Digestive Health about a year ago. And as the listeners probably know, Minji Digestive Health is based here in the Twin Cities, Minnesota healthcare company, focused on gastroenterology, and they have, been here and working in the Twin Cities for a long time and working with Pops specifically for about a year.
Excellent, excellent. Yeah, really interesting that it is another company in the healthcare industry themselves. So what was the key challenge that Minji was facing and that Pops helped with, and what kind of results were you able to deliver for them?
Yeah, well, they were facing a challenge like most other employers. Every employer that I've ever talked to is facing, which is diabetes is a really big claims cost every year, and they're trying to figure out what to do about it. It's always one of the top costs from the analysis that we see when we're talking with employers and health plans. And, people haven't seen it across the country. The people with diabetes are averaging about 4 times the cost of a person without diabetes for total claims. And unlike what some people might think, that's not just about high insulin costs and so forth. 75% of those diabetes costs are due to complications from uncontrolled diabetes. So it's about, their challenge was, how do you get people with diabetes that are in our insurance to actually manage their diabetes so they don't have these extra claims and uncontrolled costs? And we were able to give them this platform that I just described to you, which for us is all about the experience we're giving the person. And so what the results are that goes along with that experience is we saw about 26% of their people with diabetes enroll over the last year. And while they were enrolled, we saw 89% of them sustain that enrollment, which means using the product on a monthly basis to help manage their diabetes better. And so for us, we're really proud of that 89% because it speaks to the experience we created is the right experience.
Yeah, that is particularly impressive, 89%. There must be significant value if they keep coming back to it, and the value for the patient, the employee, but also value to the employer, in this case, Minji Digestive Health. So, Lonnie, can you walk me through a little bit more about it? So, Minji Digestive Health decided to offer to this to their employees. How did they get it launched? You know, what are the key activities, the milestone? Was it a heavy lift? Give us a little bit of insight into how that unfolds.
Yeah, in terms of is it a heavy lift, the simple answer is no. We make this a turnkey solution for the benefits manager so they don't have to spend a lot of time doing it. But once they agree, yeah, we want to implement the POP solution for our employees, we have a kickoff meeting with them, look at the culture that they have, look at how they communicate to employees normally. And then we have some really good account manager people that basically say, here's what we'd like to do for a 12-month communication plan out to your employees so that they're aware and POPs is visible for them. And if the benefits manager buys off on that plan, then we go and execute it and stay in touch with the benefits manager as we're doing that. And so it's really an easy lift. And what we saw was really quick in the first few months of doing this with Minji that we got that quick enrollment rate that I was talking about. And so then it's about just sustaining it and keeping visibility, and for anybody new who's in the diabetes world to make sure that they know POPs is available to them. And then one of the cool things, part of that relationship, is getting quotes back from those people. Like one of the quotes we got from one of the owners was, the POPs Rebel system is the best, innovative, easy, most portable device to use to check your blood sugars throughout the day. All companies should have this available for their employees. And so those are kind of the cool feedback we get from the relationship.
Yeah, that's excellent. That's excellent to hear that feedback. So Minji had about 1,000 covered lives, as I understand it. But since this is a technology solution, I assume that it's scalable to employers of any size. Is that accurate?
Yeah, that's correct. And we're actually, even more scalable than some of the other digital health solutions that are out there because we don't have any live coaches, and that makes us more scalable. But at the same time, we think it's a better experience for the people with diabetes. They don't have a live person kind of, as people tell us, watching over my shoulder. Instead, they have kind of this companion right in the phone. Her name is Mina. I don't know if I mentioned that, and people just are more comfortable with that these days, getting that interaction directly from their phone as opposed to a live person.
Yeah, there might be a level of confidentiality that brings a bit of comfort as well to the experience. It would be great to get your perspective on really what contributed to success. And so are there any lessons learned here from this specific case study that are transferable to other employers?
I think the biggest thing is to give the experience that your employees want and listen to your employees. That's what's going to cause them to engage in managing their health better. Too often we give to the employees what healthcare is selling. And if we can listen to the employees and what the experience is, then they're going to be more compliant and more sustainable use, et cetera. And, that's what we're kind of focusing on from the very beginning is what does a person with diabetes want, and then give that to them. The second lesson learned that I'd mention is, we just want to work really closely with the benefits manager and make this easy for them. And our account manager in Minji Digestive Health case created a very close personal relationship. And they met on a monthly basis. They went to lunch. And then that way they both can work together to make this successful for us and for Minji Digestive Health.
That's excellent. Yeah, really committed people that are passionate about making it successful can make all the difference in the world. Okay, let's move to a few questions. I'll ask them a little bit faster pace and let us dig in just a little bit more. So how did you first meet and engage with this client?
Really, it came to us through their broker. Their benefits broker told us that they're looking to solve a diabetes problem, and the benefits broker was aware of us and knew that we were a different type of solution. So he created the introduction, and the client decided to go with POPs and used our system.
Excellent. Must have been quite compelling. Why did you choose to highlight this client relationship, and what makes the relationship special?
So I would say we highlighted this one because when I say we're all about the experience, the best measure of that for us is, are people actually using it in a sustainable way? And an 89% sustainability rate over a 12-month period is a fabulous healthcare sustainability rate. And we wanted to bring that up both for Minji's digestive health sake and for ours.
Excellent. Yeah, something to learn from, definitely. What is one important but perhaps not so obvious lesson learned from this case study?
Yeah, again, I would say to really ask your employees first what they want in an experience, whether you're trying to solve hypertension or diabetes or musculoskeletal. Don't listen first to what the people are offering. Listen first to what the employees want, and then try to give them the experience that they're looking for.
Fabulous. So, Lonnie, beyond this case study, let me know what is in the future for POPS Diabetes. What are you excited about? What should employers know about or be expecting to come from POPS?
Well, what I'm most excited about is very soon your listeners will be hearing about health plans in the area that POPS is contracted with and working with. And this just makes it even more easy for them to say, yeah, I'd like POPS in my solution too. They can just turn it on essentially. And we're going to do that along with continuing to make Mina, your virtual coach, a better and better coach to help your employees be more healthy.
Wow, the future sounds bright at POPS, and that's particularly heartwarming to me since the Action Group has known you from the early days of this business. So to see it really taking off is exciting, and congratulations to you. Thank you also so much for sharing your insights on this case study, on this podcast, for being a supporter of us at the summit. We really appreciate it. I think there's some important lessons here that I heard from you related to don't just buy what people are selling, but look at what the needs of the patient are, offer them the right experience, focus on sustainability, measure success. All of those are transferable, valuable lessons. So thank you for those, Lonnie. And thank you to our listeners. Thanks for joining us today. I hope you found this case study interesting and relevant and an efficient way to learn. This and other case studies from the Action Group supporters are posted on our website at mnhealthactiongroup.org, and you can subscribe to our podcast series now on our YouTube channel. So thanks for joining us, and hope you'll be back soon.